Kentucky Equine Sports Medicine and Rehabilitation Center, which is Kesmarc here in Versailles, Kentucky. We've been doing sports medicine and rehabilitation here for 12 years, but I've been at this for about 20 years. Kentucky truly, this being in this location is truly what sets us apart in many ways. We have access to some of the best surgeons and diagnostics and veterinarians in the United States, right here in Lexington. And believe it or not, it's some of the most economical prices you can imagine. You can have surgery done here pretty much cheaper than anywhere else in the country simply because it is so competitive. There are so many great hospitals and so many great surgeons. Kesmarc, we also, we have access to diagnostics, to farriers that are unbelievably good. And it's easy to get here, believe it or not. We have planes coming into the Bluegrass Airport. I fly horses to California all the time. We ship them to Florida. They're sent all over the country easily with all the great hauling companies that are based here in Lexington as well. So there's so many things that make this area a great place to send your horse for rehabilitation. It's this place, it's my staff. I have had some of my staff members here for 17 years that have been with me. We've done more hyperbarics than anybody in the world on a horse. And we've probably seen and rehabbed more injuries than just about anyone out there as well. So, we take a very team approach. We work with veterinarians from all over the country. When your vet sends a horse here to Lexington, I can promise you he's probably got a classmate practicing medicine here with all of the veterinarians that we have in town, and he'll feel comfortable sending a horse here, working with another veterinarian, and we'll keep him in the loop the entire time. So it's a very unique place. It's a beautiful place, and if you send your horse here, then you have to come visit as well, which isn't such a bad thing to have to do. Lexington has also, I foresee Lexington becoming the summer home of the sport horse. It's happening more and more. Of course, everybody's in Wellington in the wintertime, and if you ever go there and you understand the complexity of the Wellington show circuits and all of the great things that happen down there from, hunters, jumpers, dressage, polo, you know why everyone's there. I certainly foresee Lexington becoming the hot spot in the future. It's already happening that way. Reed Kessler and so many of the great riders in this country are calling Lexington their summer home now. The infrastructure here is fabulous. The Kentucky Horse Park is probably one of the most amazing showgrounds anywhere. We hosted the World Equestrian Games a couple years ago, and it was a huge success, and we're all excited to get that back. But then you come and visit the town itself and the restaurants and the infrastructure and how close everything is. This is a big town in the feel of it, but when you get here, it's really quite small and quaint, and there's so many fun things to do. If you are into horses at all, then Lexington, Kentucky, and the area around it is the place for you. So there's a lot of things that set us apart, and I look forward to anybody coming and taking a tour of Kesmarc. We give regular tours, so don't hesitate to call the office and we'll set you up. Well, this is a lovely standard bred that we are aquatredding here. The Aquatred is one of the water modalities and tools that we use here at Kesmarc. This horse has come in for a freshen up. There's not really anything physically wrong with the horse. He had a wonderful season, made about $500,000. The trainer sent him in to have hyperbarics, was turned out for 30 days with hyperbaric oxygen therapy, and then at about day 30, we started aquatredding him, and we're going to alternate him in the aquatred and the swimming pool, so that when he goes back, he has the best of all worlds. He has had a good break. He has some conditioning, so he doesn't have to start from scratch. And looking forward to a very big season from this horse. He's a lovely, lovely pacer, and like I said, nothing wrong with him. The beautiful thing about the Aquatred is that you get a lot of resistance training for these trotters and pacers. Really strengthens them with their natural gait. The pool certainly gives a lot more cardiovascular workout, which is great. But this is a wonderful way to bring these horses back. And a horse of this size has about 65 to 70% buoyancy, which we can always pound on them. They spend their whole career pounding. And the first benefit of water is buoyancy. It is keeping the pounding off of those joints. So that's what we're doing with this horse, and hopefully he'll go back and have a very, very successful season. The trainer sends him in periodically, strictly for hyperbaric recovery, sometimes not with any exercise regime at all. And these horses really go on and compete and are very good at what they do. Hyperbaric oxygen therapy has been around for many years in human medicine. There are 16 conditions that insurance actually pays for, which a lot of people don't know. We brought hyperbarics to the equine side about 15 years ago. Dr. Doug Herthel out at Alamo Pintado was the pioneer in hyperbarics, as he is in many of the forward-thinking modalities in equine medicine. I had the second chamber for horses when I was in Texas and brought the therapy here to Lexington. Started a company that manufacture these chambers. They build them in Houston, Texas, and we distribute them worldwide. We use hyperbarics in conjunction with veterinary medicine. There isn't a horse that goes into this chamber that doesn't have a prescription from a veterinarian, whether it's an infection or a complication from a surgery or just racing recovery or athletic recovery. All the horses go into the hyperbaric chamber with a veterinarian prescription. All of our operators here at Kesmarc are board certified in hyperbaric technologists, and they're certified in animal hyperbarics as well as hyperbaric safety. So we are kind of the leader in hyperbarics from a standpoint of setting the standard for safety and training. The beautiful thing about hyperbaric oxygen therapy is that it works so well with antibiotics and can give you outcomes when it comes to respiratory problems. We deal with a lot of bleeders, foals, dummy foals, hypoxic birth foals. But for athletic recovery, I think we are just scratching what we are going to be able to be doing in the future with keeping these horses healthy throughout a long campaign. This is oxygen under pressure. This is a decompression chamber. The horse is put into this chamber and the door is closed, and people say, does the horse get worried or upset? No. I mean, they all arrived here in a trailer, so they don't feel like it's any different than a horse trailer. We close the door, we turn them loose, and we're pressurizing with 100% oxygen. The oxygen capabilities in this chamber are about 98%. So, it is serious medicine, and it really has some really great benefits as well. This is our training barn here at Kesmarc. This is where the horses that are in active work reside. I have everything from world-class Grand Prix jumpers to horses that have won Grade 1 stakes, and everything in between, standard breds, thoroughbreds, warm bloods. I even have Hackney ponies here. So we deal with all breeds. This is the barn that they come in post-surgically, after the surgery's over, when they're doing their hand walking and they're getting into their water programs and starting to progress and move forward with their exercise, their controlled exercise regime. We have our indoor jogging surface in this barn. That's where we start the loading process, where we can keep them safe and controlled and monitored so that we get them moving forward in a safe way, and so the veterinarian can track their progression in a really positive way as well, so that they're not doing more than we want them to do. That's the key to the controlled exercise program here at Kesmarc. Well, this is our main room here at Kesmarc. We have the swimming pool and the Aquatred in this room, as well as this walking machine. And the beautiful part of it, people see this room and assume that it's all under a roof because of the weather. Well, that's just one of the reasons. The main reason is the mental control. I have horses in the walker right now that you're seeing that are Grand Prix jumpers. I have a very good 2-year-old thoroughbred racehorse. I have a standard bred that's one of the top in the country. So we get quite a mixture of horses here from all disciplines at Kesmarc. And what they all have in common is that if they get too excited and they're a great athlete, they may do more than we want them to do. And what this room gives us is a place that they can, they can have their water routines, they can walk quietly, and it's a controlled, quiet place where they're happy and moving. These European walkers are simply better than sliced bread in my mind. You can tell that every horse takes it a little bit differently, but they can't do too much, and that's what's so great about it. We keep it comfortable year-round. It can be snowing outside, and we're just going right on with our day like every other day. The consistent workouts that we have here at Kesmarc is part of the importance. You can't skip days when you're bringing horses back from an injury or when you're in the process of conditioning a horse. It's the consistency in which you do things that makes a successful outcome. And that is, the main reason that we're all under roof, is that we do not miss any time here at all. The horses are consistently worked. They're in the water 6 days a week, and they're under tack 6 days a week. We give them Sundays off, but they do walk on Sundays. And then a lot of these horses also have some very good turnout as well. So we try to kind of encapsulate the best of all the worlds that we can, so that these horses are safe and happy and ready to go back to their jobs. Well, this is our equine swimming pool. It's about 300,000 gallons, 16 feet deep. It's shaped like a giant donut. So when it's empty, the sides are very bowed. So if a horse ever does get in trouble, we certainly can get them out safely. Swimming and aquatreading, we have both modalities here, and I would certainly say that one is not better than the other. They're very unique and very different. As you can tell with the way this horse is breathing, this is very much a workout. It's very cardiovascular, puts a lot of wind in them. It's great for conditioning and keeping these horses fit. She utilizes the pool very well. And she probably can count her laps better than anybody. The horses that we swim with one handler are certainly horses that have a lot of experience in the pool. If we have a young horse or a horse that has not had a lot of experience in the water, we will have two handlers on those horses, one on the inside and one on the outside, to make sure that they stay safe. This horse gets a lot out of her swimming. As you can see, she's alert and happy to be in the pool. And she knows now it's time to come out, and turns that corner and heads up the ramp quietly. It's a great way to condition a horse. She's basically a very nice racehorse. She's taking the winter off. We're kicking her out and swimming her and keeping her fit. And giving her the best of all worlds, so that when she goes back into training, she's ready to efficiently train and doesn't have a lot of downtime. We swim a lot of horses with foot problems as well. Understanding that the leg is a piston, the foot is not necessarily the pump. And when a horse bears weight, they stop circulation into the foot. When they're in the pool, it's the only place, because of the elevated heart rate and because of the lack of touching, they're never bearing weight on the foot. So the pool is the only place you can physically pump blood cleanly in and out of the foot without any interruption. When we have a horse that has foot issues, foot problems, of course they need to be addressed mechanically by a good farrier or farrier veterinarian. Because if you don't address the mechanical problems, I don't care what you do, you're not going to fix the main issue. But if you address the mechanical problems and then you have the opportunity to be able to swim them, you can get a lot of the inflammation out of that foot, get a lot of blood flow, and we certainly grow a lot of foot in the swimming pool. So we utilize it quite extensively for horses with foot issues. And we also utilize the vibrating platform on those horses as well. So there's, the complexities of swimming are, there's a lot of complexities to it, and there's a lot of benefits to it. It certainly isn't for every horse, but these young horses really, some of the young and even the older horses, some of the jumpers do really great in the pool. If you have soft end soft tissue injuries, the swimming pool is the place to be, not the Aquatred. Okay. Here at Kesmarc, we certainly get horses from all over the country and around the world, but We also are a service farm for our community. I have a lot of people that bring horses in from the racetrack and from their farms. They haul in on a daily basis or a couple, 3 days a week to utilize the facility for conditioning on horses that they keep at home. So, horses haul in and out of here for hyperbarics, for swimming, and for aquatreading, for the saltwater spa, as well as the vibrating platform, and utilize the facility and keep their horses at the farm as well. So the question is, when would you send your horse to Kesmarc? At what time would you need the services of this facility? Well, there's many reasons, and it's not just when your horse is hurt. There's a lot of folks who send horses in after the horse has had some time off and simply they need some conditioning. I had a horse come in from Cincinnati last year. A gal was working full-time and she had a finished barrel horse. She sent her horse down to Kesmarc for 45 days. There wasn't anything wrong with the horse. She just didn't have time with the weather and her working schedule to condition the horse and get out to the stable every day to ride. So she sent it down here to Kesmarc. We put, I think, 40 days of swimming and aquatreading in the horse. She picked it up, went to a barrel race, called me up and said, I'm bringing it right back. I was a full second faster than I was last year, and she hadn't ridden the horse at all. A lot of times when you have a horse that's finished and knows how to do a job, it's not a matter of training. It's a matter of getting that horse in the best shape it can be in. You can utilize this facility for that. When a horse is injured, sometimes the worst place for it to be is in the training setting, and that's another subject. Horses don't understand why they are in that training barn, that they are always, whether they're a racehorse or a jumper or a show horse, they don't understand why they are not under the same amount of work schedule as they always were. You can't explain to them why they're standing in that stall or why they're only being hand walked. And when they come to Kesmarc, we take them out of that normal training environment and we put them in a completely different environment and we keep them pretty darn busy. It's amazing to come and spend a day with a horse who is in rehab here at Kesmarc. Between the hand walking, the vibrating platform, the cold saltwater spa, all the modalities that we have, a horse stays pretty busy here along with the hand grazing and the turnout if necessary. So there's many ways to utilize this facility, not just for when a horse is hurt. Sometimes it's conditioning, sometimes it's post-surgical. Post-surgical and after injury care is very important too, because sometimes the work that is done and the knowledge that we have here after a horse has surgery in terms of changing bandages and keeping the surgeon and the veterinarians abreast with every detail is as important as the surgery itself. So we work real hard to fill that gap in that gray area between injury and return to training. That's the part that people don't quite know what to do with, and that's the gap that we fill. And it's our mission to get the horse back to the riders efficiently ready to train. Sometimes they're ready to compete. It depends on the discipline and what the horse's job is, but we work real hard to do custom programs for every horse that walks through the door, work with the owners, the trainers, the veterinarians to put the best package together for that individual horse. Now we're going to talk about respiratory problems and specifically bleeders. Of course, the bleeders are, that's a condition that we see a lot more in the race horses. I see it in the performance horses as well, but mostly in the thoroughbred race horses and in the standard breds as well. We've been doing a research project here, I've been working on bleeders for about 9 years, and we have a very specific program that we've put together. Normally when the horses come to us, they haven't bled just once. Usually this is a horse that has been treated by the attending veterinarians fairly regularly, and they just can't seem to figure out what the problem is. 99% of the time, the traditional therapies at the racetrack by the attending veterinarian is what the horse needs, and it works, and the horses do great. But every once in a while, you come up with one of those tough horses that seems to have just a little bit more serious a problem or a little bit tougher a puzzle to figure out. And that's what we do here at Kesmarc. It certainly isn't me, it's the group and the team that we have put together that truly understand how to get these horses back on track. The first thing we try to do is figure out why they're bleeding. Horses bleed for a reason. A lot of these horses are allergy driven, and some of them have been on multiple rounds of antibiotics. Some of them have secondary fungal infections, and it's really no one's fault. It just becomes harder and harder to manage these horses. So what we try to do is work with the attending veterinarian and put the specialists that we have in place here at Kesmarc that we work with to put a program together for that individual. Find out why they're bleeding, treat them with the appropriate antibiotics, maybe antifungals, whatever the situation may be. Some of these horses need surgery on throats. They're all different, but they all bleed for a reason. And once we figure that out, we've had a great deal of success with sending these horses back, and it's not that you cure them from bleeding. And we certainly use the hyperbarics in conjunction with all of the good diagnostics. It is that we heal them more efficiently, and we send them back with a plan so that when they go back to training, they can be trained more efficiently and they aren't as predisposed to have the problem again. So it's not a cure. It is a more solid diagnosis. It is a game plan when the horse goes back into training, and that's kind of one of the things that we do. We do nasal washes here. We have access in this town to a wonderful clinic, a wonderful lab at Haggard's. I feel it's one of the gifts of this area. The pathologists and the gals in the Haggard's lab are so knowledgeable. We have Dr. Robert Holland, and he is a veterinarian, but he also is a PhD in equine specific infectious disease. He reads our cultures and our cytologies for us, which gives us a huge head start. And then we also have Dr. Johanna Reimer doing ultrasounds on the lungs. That gives us some great information. We work with the other attending veterinarians as well. So there's a real game plan put in place with these bleeders, and we've had a great deal of success over the last 10 years putting these horses back together. The question that's always, that's sometimes asked of me is, how do I know my horse has a problem, or when are the signs? Here at Kesmarc, we understand that, horses come to us many different ways. And I would say most of the horses that walk through the door, the injury they come with is secondary to the injury that caused it. They're quadrupeds. They've got 4 legs on the ground, and they are a very complex dynamic athlete. And if a horse has been trained to a high level, if a horse has done a job, competed at that job and done well, then I think you can honestly say that they're not going to wake up and just simply one day decide not to do that job. What happens is there's something wrong normally, and the only way they can tell you is by refusing to do something they've always done before. And that's what we understand here at Kesmarc. Horses are pretty honest, hard-working athletes, and they really do like to please, and they do like their jobs. Of course, they come in many personalities, and they all have their own idiosyncrasies, and some of the better they are as athletes, sometimes the more interesting they become as personalities and individuals. But these horses do not wake up and decide not to please us. So it's kind of, you can't just stop every time a horse refuses to do something, but you do kind of need to sit back and regroup and think about what may be going on that's causing them not to do the job they've always done for you, whether it's a jump, that first barrel, whatever it is. Horses are very honest. And when we get horses here, normally by the time they come here, they're a little defensive and they might be a little bit angry, but that's because they've been hurting for a while. They didn't just wake up and take a wrong step and become injured. They are the most compensatory creature on the planet. And with that said, if they have a front end injury, there's probably a hind end injury driving it, and vice versa. Not always, but a great deal of the time there is. So it's about putting the whole puzzle back together and putting these horses in a position where they can really efficiently heal, not just physically, but also mentally. Keeping horses happy here is as much a part of our job as anything else. Our nutritional program is crucial in these horses turning around. When a horse is in pain, their immune system is significantly weakened. And they don't always look really good. I mean, they might come in and they're carrying good weight, but they don't have that bloom and that blossom. They're not carrying that top line that they should be carrying. And that's all a part of really looking at the horse and letting the horse tell us what they need. They're very honest. They're very honest about their needs. So we really pay close attention to not just the physical needs of the horse, but the psychological needs of the horse, and how he deals with stress and why he deals with stress the way he does, and just how happy or unhappy they are. Horses come in here. It's my mission when they come in, if they're a little unhappy, I want them to leave a lot happier. I want them to leave ready and wanting to go back to work. That's part of the job here at Kesmarc as well. You know, one of the most important things that we do here in Kesmarc is we are here to preserve the veterinarian's work. We are here to make sure that all of the information that your veterinarian needs is given to him in the correct way, that he can understand and move forward with a progression for the horse. That's another huge part of what we do here. We are here working to do what's best for the horse, and in doing, if you always do what's best for the horse, at the end of the day, everything comes out great. And the veterinarians really count on us to give them the correct information, the proper follow-up care, the reevaluations at the right time, not moving forward too quickly, knowing when to move forward, knowing when to wait. Those are the things that the veterinarians count on us here for, that we have, you know, over the last 20 plus years of putting these programs together. But working with closely with the attending veterinarians is something that we feel really strongly about here at Kesmarc. Every horse at this facility has a veterinarian attached to it or a clinic attached to it. Every horse. So there is no horse here on a free-for-all. They are all here under the care of a veterinarian, and with, you know, sometimes with the trainers. If they come in for just conditioning, it's often the trainer that is putting the program together with me. So this is very much, we are a team approach, a complete team approach to getting these horses the best they can be. Thank you for joining me at Kesmarc. If you have any questions about the conditioning or rehabilitation of your horse, don't hesitate to call the office. And if you ever come to beautiful Lexington, Kentucky, please don't hesitate to look us up. You can also get more information on kesmarc.com.